So it's Michael Marion, last name is Marion, and I'm a plastic surgeon. I've always wanted to do something active, and so, growing up, I thought I don't want to sit behind a desk and, I don't know, push numbers or whatever. I wanted to be more hands-on. I'm really lucky. I think we've really benefited from picking great staff. We have a lot of people filling a lot of different roles, and as we continue to grow, it's been interesting to have more needs and have to fill those needs.
I think we have a great atmosphere. I think the employees are great. They're welcoming. We get great patients. There's a number of things that we do, anywhere from, breast augmentation to mommy makeovers. We do a lot of mommy makeovers, gynecomastia, which is a male breast reduction. But mommy makeovers, probably for the women, are the most popular, and that consists of a number of things. You're looking at maybe liposuction, breast lift, breast augmentation, maybe even a tummy tuck. So there's a wide range. He does it all.
The common procedure that we do is what's typically called a mommy makeover, which is any combination of work on the abdomen and the breast. And part of the abdomen is traditionally a tummy tuck or abdominoplasty. And the way I do abdominoplasty, somewhat unique, certainly not the only one, but the technique is called a progressive tensioning suture. And what it is it allows for us to do the tummy tuck or the abdominoplasty without having to use drains.
The cool sculpting freezes the fat. So it's also a fat reduction, just like the liposuction. It's a more non-invasive procedure.
It goes in, freezes your fat cells to cell death, and those fat cells basically are gone completely after that. And then after 3 to 4 weeks, you will start noticing somewhat of reduction, depends on the person, up to like 3 months. So you can see the results after 4 weeks, up to 4 months.
The tummy tuck it's a great procedure for moms who have had multiple kids, and they just have that loose skin or stretch marks from their pregnancies.
The way that I do the abdominoplasty or tummy tuck is a technique called progressive tensioning sutures, wherein we do the abdominoplasty without having to use a drain. It takes a little more time in the operating room, maybe 20 minutes. Essentially what we're doing is we're quilting the tissues into place so that there's no opportunity for fluid or other issues to occur. And again, it means the patients don't need to have drains when they go home, and we don't have to take out drains in the post-operative period. Our breast augmentation is I use what's called a Keller funnel, Keller named after someone. And essentially what that is a sterile piping bag, like you use for a cake piping bag, a funnel-shaped bag. And it comes in a sterile package, and it allows us as surgeons to not have to manipulate or touch with our gloves the implant, which decreases the chance of other problems or complications of surgery.
It's actually a really, really great thing to bring into the procedure. For one, it keeps it so he does not touch the implant at all, which then we think helps with capsular contracture, just some of the risks that can incur with the breast augmentation. Dr. Marion's great to work with. He understands his patients. He gives them the time that they need for their consults, which they really appreciate, and they tell us that.
So new patient consultations I do for free. It's really just to give information and let people, oftentimes they're calling in, they have questions or they've considered things, but they're not really sure what that means. And so a lot of it, I think, is just giving information, sharing information, try to listen to patients' concerns, and then really with that information, helping them to make a decision. And then with that information, try and help them do what's right for them, what's the right choice for them. I think we really try and harness just being very straightforward, honest with patients, giving them straightforward information, not trying to, make things look like what they're not.
I thought I'd give them a try and came and met with them and just fell in love. The office staff is amazing, and I was definitely nervous, and I had a lot of questions, and that's why I liked not even just Dr. Marion, but also his nurse, Jen, answered all my questions. They made me feel comfortable about it. I felt like I was in good hands. I have his full attention. I don't feel like I'm being rushed out of the room to the next patient, and everyone's always excited to see me, and I'm excited to see them when I walk in too. So, yeah.
lovely, actually. The whole entire staff, including Dr. Marion, is very helpful and it's almost kind of like they make it a warming environment to come to. And so it's almost kind of like a family environment.
I like to come to Dr. Marion for my face, basically. I come for Botox injections. He does my lip injections. And in the last year I've been a patient of his, I've actually had the most compliments on my skin, thanks to him. So yeah, he does really good. Yeah.
It's been worth every penny. It's kind of, it's helped me become more, I actually enjoy my body in a different sense that I would never thought I would.